Yeah, Prolozone is it's ozone, which is activated oxygen. You can show the machine there if you want to show them that. There's an O2 tank and a longevity machine. There's different machines out there. I've been using that one for a long time. Other companies are good as well. But that makes ozone, that machine right there.
Right.
So in fact, we'll make that up here right now just to show you. I could usually use a different strengths you can use, but roughly 28 to 30 something gamma is what I'll typically use for ozone injections. Blue syringe.
And so I've been referring people, I've had about, I don't know, 10 injections we've done in my low back for my discs. And so the whole point is we're trying to stimulate the body's own healing mechanism, unlike a steroid injection.
Yep. Prolo means to proliferate, and you're actually making cartilage, you're generating an inflammatory response. That's how we heal when we injure ourselves. You know, it hurts and all that stuff, but you're inflamed and you're healing through that inflammatory process, and ozone stimulates that inflammatory response.
Hey, it's Dr. Rimka, and here I am getting a Prolozone injection with Dr. Frank Matalone at his office. I use ozone to help repair a back injury, so he ends up doing 4 injections, and he's going to explain it a little bit, and we end up talking about carnivore, so I hope you enjoy. And yes, it does hurt a little bit.
You looking at this or the whole thing?
Whole thing.
The red color is B12, that's why the solution looks red. For those wondering. Procaine is in here, arnica, biocean minerals, and B12. How's it doing stuff?
Okay.
Okay so far?
It's more on the ozone. Yeah.
I'll go nice
It's
and
the
slow.
pressure.
I'll go slow. Alright, ozone gas, I'll just slowly pulse it in. Distraction technique here. See if that helps. You just let me know when you start feeling the pressure.
It's starting.
Already?
Mm-hmm.
Because I probably put much in there. If you're just super sensitive to it, I guess. So tell me about this carnivore diet thing.
Oh boy.
What are the parameters of that? Just all meat?
Any animal? Anything?
Any flesh food?
Anything. And you know, there's a lot to be said for going nose to tail.
Mm-hmm.
Organ meats and stuff.
Felt that one.
Yeah, oh, it's okay. It's okay.
So organ meats
So
included?
ultimately, yeah, I prefer people absolutely add that in, even if they have to use the pill form, you know, because they're being wussies. Mm-hmm. So you can do it very short term to deal with, you know, it's the ultimate elimination diet. Unless they have the, you know, tick-borne meat allergy, it's going to eliminate so without all that rotation diet crap and everything, and SIBO, and so as you're treating stuff, you just get rid of every plant toxin and every allergic autoimmune trigger. So some people we just do it 4 weeks. Some people we go for 3 months, 6 months.
And it's strictly meat, no...
So everybody's a little bit different. Like, you know, technically eggs and cheese would be on the relaxed kind of carnivore.
Yeah.
But that's cheese would be...
Because it's derived from animals.
And I'd prefer they have an A2 raw, you know, casein.
Sure.
But, you know, everybody's different. Like, again, a Hashimoto's patient, I won't allow dairy at all. You know what I mean? And Epstein bar, and no, you know, I'd say no chicken, no eggs, just to cover my bases on the body. Right here, Dr. Matalone asks me about if everybody can afford carnivore, and we start having a discussion about expense.
Everyone can afford that, so
It's
that would be
right.
nice.
It saves so much money. me eating carnivore, I don't know if anybody would say it's more expensive. It's not. Because that other process,
they're not eating the other stuff.
I know. It's oh God.
Right there, that oh God was because it really hurt going in on the nerve.
That's my carbon footprint only. That's all you're eating. I mean, it's really cost effective. I mean, I save money, Frank, and I eat filet mignon most of the time. Like, that's my preferred.
Making me hungry, yeah.
Yeah. Filet mignon with some chicken wings, shit. That's the best.
To try to get the knee cap to fall back into where it's supposed to be.
Is that painful doing this?
It's a little painful.
Yeah, I don't have any crepitus or grinding. All right. So just let it hang.
Right in there.
Space. Get in there. This is medial, this is lateral. So either side, whoever has probably about there. But it feels narrow, but I can get in there. It's a super skinny needle. Have you had steroid shots in any ever?
Oh yeah.
Probably multiple, right?
Oh yeah. I've had those like Restrocome injections.
Oh, you did all that stuff?
I've done all of it.
All right. So when was the last time you had a steroid shot?
Probably 4 or 5 years ago.
Okay. So Steph has told you about Prolozone a little bit. Have you checked out any YouTube videos? You've done all that stuff. Average person needs 5 or 6. That's average. Had some people do well even with 1, but average is 5 or 6. Even I've had Prolozone, and mine was 6 for my back and a few in my knee. But in any case, more chronic, more problems, probably requires more. But start with Prolozone. There's always stem cells. I do those as well. We can always do those as well. But weekly Prolozone shots is what I usually recommend, a week or 2 apart at the most. Try to do it weekly if you can. I know your schedule's a bit tight, but do the best you can. Put some arnica in there as well, some procaine, B12, mineral blend.
So Frank, explain what you just said. So Prolozone is a blend of...
Am I filming that?
I'm recording, yeah.
Hi, Mom. Yeah. Prolozone is, it's ozone, which is activated oxygen. You can show her the machine there if you want to show them that. There's an O2 tank and a longevity machine. There's different machines out there. I've been using that one for a long time. Other companies are good as well. But that makes ozone, that machine right there.
Right.
So in fact, we'll make that up here right now just to show you. I could usually use a different strengths you can use, but roughly 28 to 30 something gamma is what I'll typically use for ozone injections. Here's a syringe.
And so I've been referring people, I've had about, 10 injections we've done in my low back for my discs. And so the whole point is we're trying to stimulate the body's own healing mechanism, unlike a steroid injection.
Yep. Prolo means to proliferate, and you're actually making cartilage, you're generating an inflammatory response. That's how we heal when we injure ourselves. You know, it hurts and all that stuff, but you're inflamed and you're healing through that inflammatory process, and ozone stimulates that inflammatory response. So there's ozone
it's gas.
in there. It looks clear, but that's about 98% oxygen and 2 or 3% ozone. So we've got that there. We turn that off. Let me give you a little test blast of this stuff here. How do I say first name?
Kelly.
Kelly. With the Irish spelling, is that okay?
That's correct.
Okay. All right.
So Kelly's been having some knee problems. She had multiple injuries and multiple surgeries a long time ago. So we're going to go a little bit more natural route to promote her knee regenerating tissue.
This syringe will be to inject the solutions I use, which is typically procaine, some Biocean minerals, some B12, and arnica. My usual mix is what I put in there.
And procaine is a drug.
Yep. Anesthetic, improves membrane permeability, membrane potentiation. So we'll mix all that in there. Here's some arnica. This is informal filming, guys. I didn't know I was being filmed, but
It's okay. We're going to edit. We'll see what we'll do with it.
yeah.
But a lot of people don't know what this is. I think I'm covering. They've seen me get my blood drawn here, and I'm about to get my ozone. I'm about to get that gas put into my blood, which you guys have seen me do a video here before. So this is Dr. Frank Matalone, and this is.
We did that like a year and a half ago or so, right? That
Yeah,
thing,
yeah.
Got a lot of
People
hits.
love it.
Yeah, there were.
Explains it a lot.
So that's the minerals. This needle is not to be injected in her. This is just to draw stuff up. So people are probably saying, "Oh my gosh, that's a huge needle. I don't like that." This is not for you. This is just to draw up the juice, I call it.
Yeah, and I might edit.
Yeah, I was kind of thinking, he said it was a tiny needle. I hate
Yeah,
to
this
see
is
his
not
idea of a
for
big
you.
needle.
Not for you.
I'm not live. I'm just recording.
There we go. I'll just do a little hit up there.
And so Kelly had some questions. She asked, does it hurt? And I said, well, I've had it again in my sacrum and for discus. I haven't had my knee done. I go, it's not. And I go, everybody's response is a little different. The location will matter, but there's definitely a pressure because it's gas.
Feels like
Can you
a
explain
balloon.
that?
Like a balloon is blowing up. You've had yours in your back, so it's
Yes,
a different
different
experience,
feel,
but similar in that it's like a balloon sensation filling up in your knee.
Yeah.
Really doesn't hurt. If you go too fast with anything in life, I was an ER doctor, so if you inject anesthetic too quickly, you're expanding tissue rapidly, so it hurts. If you go slow, it's not so bad. So there we go. There's our juice. So that's your skinny little needle. You can barely even see it from where you are. But prime it. So there we go. All right. Got my ozone drawn up. Let's get her done, as they say. All right. So this is her right knee. There's the patella. You feel the bottom part of the patella, and you should slide into a little groove laterally, or you can do it medially. I usually do lateral, but you can do either or. But I'll try to go laterally. Either just your anatomy or the surgeries or whatever. Your
My patella groove has always been.
gap's a little narrow, it
Yep.
feels like, but I
That's
should
why
still
my
be able to
knee
get in
has
there.
always
Yeah.
like fluctuated and popped out and go to the side, grind.
So some people will draw all over people to mark the spot. I usually use the tip of my plastic needle as a nice little target impression, which you're about to see. Like I said, yours is narrow, but I can stick my thumb in it. It kind of just falls on its own within that. It's narrow, but we'll get in there. Yeah, that's about your best spot. See how it pushes in? I'll make a little impression. And that's the target. All right. So, not that we need alcohol because ozone kills everything, but I'll give it a little swab-a-roo.
An ER doc habits hard to die, right?
Yeah. Some people just like it as well. I feel, oh my gosh, it's killing the germs on the skin. Well, it may or may not, but whatever, we'll use it. So, cold spray again, remember? Just a little, so you don't jump. And you relax, knees hanging, just let it hang, let it hang. I usually do this just to kind of keep people from moving. In fact,
And the knee is one of the more successful joints with Prolozone. Don't you think
yeah, it's probably
historically?
the most commonly injected joint that I do for Prolozone, but I've necks, backs, elbows, feet, ankles, wrists, fingers. You can do it all. And then, of course, there's trigger points. All right. Here we go. All right, I'm lining up, bevel up, cold spray. Give you a little tickle scratch. I just kind of let it glide in on its own. Hopefully I don't hit much resistance. Is that hurting?
A little bit, not much.
You have, like I said, a narrow gap. I can feel it. I had to move it slightly. Now you see it goes right on in. Yeah. Like I said, it's narrow, I could tell, but it's going in just fine. I could force it much harder, but you don't need to. I just go nice and slow, let it do its thing. You can pull back a little bit.
How are you feeling?
See, now I pulled back a slight bit. You doing okay? Did you feel much, anything?
Not really.
Not really, yeah. No, that's my technique. The cold spray and the scratching. So it's flowing in very nicely.
Do you feel any pressure? Like, do you feel
A
like
little
getting
bit,
bigger?
yeah.
Okay.
You might a little bit, but
Nothing
and this is
major.
nothing. This is only 5 cc's of the solution, and then next you'll watch me do this. Disconnect, leave the needle in, hold that there, stabilize it that way. And this is the real magic right here again is the ozone. Just hook that up.
Oh, so that was the solution with everything.
Yeah.
Got it. Now,
Yeah,
okay.
that's
I missed
the
that.
real magic is the ozone gas.
Now you're going to feel.
Yeah. So this is where you'll feel more of a balloon sensation.
Yeah.
Because it's more volume, more fluid.
Yeah.
And you'll let me know how you do. If it gets painful, let me know. See, I'm going slow again, little pulses I'll give. There's no resistance whatsoever. This is going in very nicely. The biggest joint in the body is the knee. It can accommodate a whole lot of fluid, whether it's a liquid or gas, that's fluid in physics. People, tear their ACL and they get these big swollen knees and they go in and aspirate fluid out. You probably have that done as well, right? You can pull out, this is 60 cc's, this syringe.
Yep.
They can pull out 60 or more cc's.
Sure.
It just goes to show you how much volume a knee can accommodate. Doing okay?
Yep.
Yeah. Feeling full a little bit?
Just feels
barely?
Yeah, a little bit of pressure, but
Yeah, not bad. All right, so I'll give you, try to go for at least 20 cc's. Some people will do less, but typically at least 20 or more. You're about 30 cc's right now. As long as you're comfortable, I'll just give a little bit more.
Sure.
Yeah. Like I said, it can accommodate a lot. More is not always better, but it's going in so easy with no resistance. I'll just probably give you at least 40 cc's. We'll be done here in a second. Okay, that's good. Start with that. Got a little bit of blood. We'll just put pressure. In fact, you can hold it yourself while I clean up my mess. Number 1 Prolozone for Kelly today on her knee, right knee. That was
There
it.
we go.
Not bad, huh?
Not bad at all.
Right.
Not bad at all.
Yep. All right.
All right.
Just for the needle folks again, that's the most commonly used needle. It's a 27 gauge, 1 1/4 inch needle. So very skinny, flimsy little needle, right? Steroid shots usually require a bigger needle because it's thicker, viscous stuff. So you need typically a bigger needle, but that's most commonly used right there.
Yeah.
Skinny little nothing needle.
And I gotta say, your technique, you do that spray, you don't feel the needle going.
Yeah, most people don't.
Yeah, it's not the issue at all.
Move your knee around a little bit. Just kind of hear that.
Oh, wow,
You'll sometimes hear this kind of sloshing around sound of the fluid, right? The solution and the gas in the knee. You might even hear it a whole day later. When I had my knee injected 5 years ago, I even noticed that the following morning. I still had that sloshing around.
Yeah.
Not everyone gets that, but some people do.
Is there any post instructions that are important?
Normal activity, don't take any anti-inflammatories. Prolozone's generating an inflammatory response. You don't want to negate that. Although I've even seen it work when people have done, when they cheated.
So we're not
Still
taking
took
any
it, but-
Tylenol, things like that.
Yeah, just leave it, ice it if you have to. Normal walking, I wouldn't go crazy on exercise or whatever. Typically we'll tell you that for up to 2 days. People always cheat all the time again to do their thing.
I'm all for the next 2 days.
Essentially, so you'll be fine. I'm not against natural anti-inflammatories. If you're taking turmeric or curcumin or whatever stuff, fish oils, etc., that's fine. It's just the prescriptive or over-the-counter non-steroidals I don't want you taking, preferably. We were taught that. But again, some people cheat and still do it, and they still get a good response to Prolozone. Over 90% of people respond really, really well to Prolozone.
All right.
So
Awesome.
that's it. If you're not bleeding at all, check and see. We have little Band-Aids if you need it. If not,
I'll be okay.
some people don't want it, but little circle Band-Aids if
Thanks
you
for
like.
showing this to
Yeah,
us, Dr.
that's
Matalone, and thanks,
Thank you.
Kelly, for being a
Appreciate
participant. So
You were
people,
a
if you're
champ.
suffering
Good.
out there with joint issues, pain issues, you know, there's a lot of other options besides just taking pain meds or doing steroids, which really sets you up with a different
Or surgery.
or surgery. Right, you
Yeah,
got
a
to
lot
try
of
other
people-
things, you guys. And so Prolozone is using
Get a little bit
oxygen.
of blood still.
Then you can go all the way to,
Yeah,
there's
keep that
also
pressure
stem
on there.
cells, there's also exosomes. There's just more to do than,
Yeah, and I do all that stuff as well.
yeah.
But 90% of people do really, really well with Prolozone. And, you know, before even getting into talking about stem cells. But yeah, we can do all that.
Yeah, one step at a time. All right, thanks guys.